Okay, this is chapter 29, Immobility. I know we just got finished speaking about activity and exercise, so this is kind of like building on that. We all know that a person's capacity to move around freely in their environment is really critically a critical element for health, as I previously discussed. I mean, it serves many purposes and requires the functioning of the nervous along with the musculoskeletal system. So it's important for you to understand the movements and functions of muscles and maintaining posture, and in order for you as a nurse to be able to implement evidence-based knowledge and take care and patient and to handle patients in a safe way. Okay. Okay. So scientific knowledge base, we start with movement. When the musculoskeletal and nervous systems work in concert or together, the result is movement or coordinated body mechanics. Um, we talked about previously about body alignment and posture. Um, I do want you guys to know what the difference between body alignment is. Uh, when we talk about body alignment, body alignment means that like the individual's center of gravity is stable. We spoke of that before. There are a lot of different things that can happen to an individual that are pathological, which may influence their mobility. There are postural abnormalities that a person may have with their musculoskeletal system, muscle abnormalities that an individual may have uh, when they have disability or deformity. A person can have central nervous system damage, like a stroke or something of that means CVA. And then, of course, direct trauma or fracture to the musculoskeletal system. So, um, nursing knowledge base, as far as safe patient handling, is that's how to apply whatever understanding that you have to when you think about a person and their movement. So, first of all, when you're safely handling a patient, you have to always uh, think about things like ergonomics and a person's ability to move. Um, there are various assessment protocols that people leave at work and different things like that to make sure that movement is good. Uh, so you need to use whatever algorithms you need to use as far as handling a patient and movement, any type of special equipment that we have discussed earlier. Um, and you want to make sure that you don't have any type of back injury or you protect your back. Um, and no lift policy. And what that mean is basically they don't want you to lift a person on your own. So a patient's immobility can result in respiratory changes. Um, a person can have what they call hypostatic pneumonia, um, uh, which leads to inflammation of the lungs and stuff and secretion. They can have metabolic changes, like with their BMR rate, it can be decreased. They can not metabolize like the proteins and carbohydrates and fats that they need to break down because they uh, aren't moving, fluid and electrolytes imbalances, which may result in diuresis because people who are immobile usually tends to have increased urinary volume because of the shifts in the blood volume when they're not moving around. Uh, it can gastrointestinal things like decreased peristalsis and constipation can occur. Orthostatic hypotension is considered one of the cardiovascular changes that can uh, occur. A person can have joint contracture, foot drop, disuse, osteoporosis, pathological fractures, uh, and then skin breakdown, which would be considered integument changes. And like I said before, I already talked about urinary elimination changes and the fact that they're not moving as much. Also, they can develop urinary stasis and it can lead to urinary tract infections. So basically, here is pictures of uh, fixation contracture of the elbow, you know, resulting in a permanent like flexion of the joint. So a person has that permanent flexion here of the joint, as well as here's a picture of a person with foot drop, and that's the reason why we use various shoes to help them not be able to have foot drop or put footboards or different things like that. You notice respiratory changes in your immobilized post-operative patient. The change you note is most consistent, uh, probably with atelectasis, which the lungs and stuff collapsing. Case study, you got a Miss Eileen Thomas. Miss Eileen is 82 and she's admitted for a fracture of the right hip. She is complete bed rest and she is in Buck's traction. Sergio, who is the nursing student, is assigned to Miss Thomas. There are psychological effects of a person being um, immobile, of depression, feeling like they're socially isolated. Um, they can have sleep wake disturbances and impaired coping. I'm actually going through all of these things with my one of my parents at this time, and it's very traumatic. It can be very traumatic. Um, a person can have various sensory alterations. I mean, like for instance, if they're in the bed and they're immobilized, they may have decreased stimuli, and then, like I said, their self-concept and socio-cultural responses can be impaired as well because they're not getting that stimuli that they normally have. Um, as far as infants and toddlers, immobility can affect them. It can delay their motor skills. It can delay their intellectual development and their musculoskeletal development. I mean development as well. And with adolescents, there is a delay in them gaining independence and accomplishing skills, and also social isolation can occur, which can be very difficult. Adults tend to have more problems, I would say, with changes in the family and social structures. They tend to have more physiological problems at risk, and then older adults increase dependence, because that means that they're dependent on people to take care of them, and then losses of their functional system can affect them quite a bit as well. Okay, so Miss Thomas's mitral valve was replaced 2 months ago, and since that time of surgery, she's been on anticoagulants. She has had type 2 diabetes for the past 10 years and is a smoker. She weighs 195 pounds and is 5'7". She lives by herself and she attends Mass daily. Her pain is six of 1 to 10. You're going to have critical thinking knowledge. You're going to have knowledge about pathophysiology, human growth and development, and culture, and try to understand what types of things are common so that you can give the best type of care that you can. Of course, your clinical and experiential experiences will affect how you care. And then you have to become creative. You have to have perseverance and you have to have discipline and then be pretty ethical. So, as far as the nursing assessment and diagnoses and that type of thing, uh, you can have, you're going to, first of all, you're going to assess their mobility, and you're going to assess that mainly by range of motion and activity tolerance. You're going to assess their respiratory system at least every 2 hours. If they're immobile, you want to engage them with incentive spirometers. You want to see if they have diminished breath sounds or any adventitious lung sounds. You're going to assess their metabolic system. You're going to assess them for how much they're eating, whether or not they have anorexia, uh, their dietary their dietary intake, and then anthrometric measurements like height, weight, circumference, that type of things. And you want to measure them every 2 to 4 weeks to make sure that that person is in a line with what they're going through. And I'm going to tell you guys, it's very, very difficult to take care of somebody that's turning or have made themselves immobile, and to get them to do all the things that they're supposed to do. You want to check them for edema as far as their cardiovascular system, and make sure that their heart is working the proper way, skin integrity and breakdown, and whether or not uh, they're urinating the proper way and they don't have any signs of kidney failure or fecal impaction or anything like that that can occur. And then their psychological condition is so important because they tend to get very, very depressed, and they have kind of messed up sleep patterns. And as far as their development and their consciousness, as far as what they need to do to make themselves more healthier, is a better thing. Older adults, the effect on their independence and functional status, when it declines, it can result in altered family relationships as a person grows older. The muscle mass is reduced because of the fact, and posture is different because of bone changes and age progression and things. And so, what we have to do is we overall some type of activity, some type of uh, getting out, some type of movement is necessary when they're in that age to keep them going. So as far as like I was saying about nursing diagnoses, there's tons of nursing diagnoses that you can use for a person that is immobile, such as ineffective airway clearance, risk for constipation, risk for disuse syndrome, risk for falls, impaired physical mobility, impaired skin integrity, deficient fluid volume, impaired urinary elimination. All of those things play a process and a role. So, of course, it's good to have patient centered goals. You need to set priorities based on the patient's mental and physical health and what you think is the most urgent for that time. And you also need to collaborate with family specialists and tap into community resources. You do need to promote health. You don't want any work related injuries if you got a person that is in the workforce. Uh, Use all types of fall prevention measures because you don't want them to fall and especially and end up breaking a limb or something, and then encourage exercise. uh Exercise is just the most wonderful thing, you guys. And prevent disuse syndrome. It is very hard when you're working with the elderly population and trying to get them back, because you're trying to do all that you can, and then you start seeing this decline, and you know that they're not getting better. To you looking at them, and let's say you measuring it monthly, you see them getting worse. So it can be very emotional. Make sure that the respiratory system, you promote expansion of the chest and lungs, preventing stasis of pulmonary secretions. You want adequate nutrition. That is just like central, because it promotes their tissue being strong and them doing everything. So, based on this particular person, this Eileen Thomas, medical history of type 2 diabetes and heart valve replacement, and being an active smoker, uh, you can list three nursing interventions that you would initiate to prevent uh, uh, um, respiratory complications related to her immobility. So you would think about it, and first and foremost is um, exercising the individual person, maybe helping them get an incentive spirometer. Make sure that you turn and make sure the person cough and deep breathe. Eliminate the smoking. Monitor vital signs. So you want to prevent blood clot formulation. So you would use things like they would have TED holes and those type of things applied. Um, you want to incorporate exercise to prevent disuse syndrome. At least 2 hours in a 24-hour period. And then you're going to maintain their skin and prevent pressure ulcers. Um, Elimination system, you want to encourage drinking of fluids, and you want to monitor them for stones and urinary tract infections. And you want to prevent social isolation and enhance their self image. So you need to think about those times. Maintain a patent airway. Like I said, exercise. You want to reduce cardiac workload. Um, uh, I did tell you about the embolic elastic stockings and the sequential compression devices, which are really cool, that they have in the rooms as well. So these are applying anti-embolic elastic stockings, which can be very, very challenging. I'm thinking that you guys did uh, practice this application in the lab. Uh, Here are pictures of how you put it on appropriately, and you want to make sure that it's free of any types of wrinkles or overly compressed, and that it's the appropriate size for that individual. Uh, the sequential devices is like you wrap them around the legs and the machine actually tightens and then lets go, tightens and lets go. And this is a picture of them getting ready to apply that. And you want to make sure you check circulation and you're able to put your finger in between it to make sure it's not squeezing too tight. And they set it. Okay, so after completing preoperative teaching for a surgical patient, you can evaluate the patient's understanding of the use of elastic stockings when the patient states, I can remove them at night, I can roll them no lower than my calf muscle, I wear them no longer than 4 hours at a time, I can remove them for 30 minutes every uh, day. So, it would be uh D, that they can remove them 30 minutes every 8 hours or so. So you need to exercise. They need to do range of motion. They need to do body alignment. You need to turn every 1 to 2 hours, shift weight every 15 minutes. Um, you need to provide stimuli, whether there's television, whether there's music, whether there's people visiting them, and that type of thing. Uh, when you're transferring the patient, always make sure what you're going to do and always talk to the person and tell them what you're going to do. Make sure you always have the appropriate equipment to move them. Use the patient's strength when lifting, transferring, or moving when possible. And make sure that safety is the main priority. You are going to evaluate how they do instrumental activities of daily living, activities of daily living. You're going to use any type of adaptive devices that can help them. And sometimes it's really good to get occupational or physical therapy there in the home to reinforce exercising and teaching as well. So at the end, you're going to evaluate if what you planned was getting better and if their mobility is getting better, and that's it. So if you have any questions, because this kind of played on the other one, make sure that you just read them. I would say the most important things is knowing how to properly lift someone, knowing how long you use these devices, how to applicably apply like Ted holds, what type of things when it comes to systems, how to assess them in terms of what type of things you want to do as far as their breathing is concerned to make sure their lungs are the way that they should be, and to keep them active. Okay, that's it. Thank you.